You are listening to Hilary Topper On Air.
Welcome to Hilary Topper On Air, episode 525, the podcast that dives into the heart of endurance sports, fitness, and lifestyle that fuels your passion. I'm your host, Hilary Topper, and today we're tackling an issue that's quite literally a pain to talk about, but one many runners and endurance athletes face. That's right, we're discussing bunions. If you've ever felt discomfort or pain on the inside of your foot during a long or after a long run and wondered what that little bump on your toe could be affecting your performance, then this episode is for you. Bunions aren't just about aesthetics. They're biomechanical challenges for many athletes, adding strain during high-impact activities like running, cycling, and even walking. We're going to explore how bunions affect your gait, what that means for your overall performance, and most importantly, what you can do to manage or even prevent this common issue. Whether you're preparing for your next marathon, triathlon, or just love logging those long miles, taking care of your feet is crucial. And a small adjustment can make a huge difference in your comfort and endurance. Stay tuned as we break down bunions and their impact on endurance sports, tackle myths, and share practical strategies to keep your feet healthy and strong. Trust me, this one topic you don't want to miss. Before we move on, I must say that I am so appreciative of our sponsors and must take this time out to thank them. The Russo Law Group, PC, Long Island's signature elder law, special needs, and estate planning law firm. For more information, visit vjrussolaw.com. That's vjrussolaw.com. I'd also like to thank PlayTry. Get everything swim, bike, and run at PlayTry. They have locations across the country with their main headquarters in Dallas, Texas. You could go to playtry.com/store. That's playtry.com/store. Or if you're interested in franchise opportunities, you could check out playtry.com and go to Own a Store, and you can find all the information there. They're a great brand. They have so many different options, and I know you will get great prices and a great selection there. Today's episode, we're going to be speaking with Dr. Ebonie Vincent. Dr. Ebonie Vincent is one of the leaders in her field. She is a trailblazer, an educator, a TV personality, and highly skilled foot and ankle surgeon. Welcome, Dr. Ebonie Vincent, to the show. Could you tell us a little bit about your background and how you got started in this field? I mean, do you go to school thinking, oh, I want to be a bunion surgeon? Like, how does that happen?
That's like the golden question. Like, how did you get into this, right? So, I grew up in California and I'm an athlete, been a student athlete my whole life. So, I have personal history with two knee surgeries. And so, my whole aspect of going to school was to become a doctor, to become a surgeon. And honestly, podiatry, the field found me. It definitely appealed to women who were more entrepreneurial, wanted to be surgeons, but also wanted to have families and time. So definitely got into podiatry for that reason. And as you know, podiatrists are foot and ankle specialists, and we do a lot of surgery. And namely bunion surgery. So, I mean, it's definitely a needed field. Takes skilled hands and a caring heart, because feet are not the most glamorous thing, but we make it better.
Yeah, absolutely. And I feel like I know so many people with bunions, and there really is an issue when you're walking. But I want to ask you first, before we get started, can you talk a little bit about how bunions affect runners and triathletes?
Right. So when we're thinking about bunions, you first have to know that it's not just a bone that's growing on the side of your foot. Like this is a biomechanical issue that most people are born with. It probably doesn't start off as being like, oh, wow, look at my baby's born with a bunion. But over time, genetically, you're more prone to just getting those bunions. And then the bunions can become worse with the types of shoes we wear or the activities that we do. So it's mostly a genetic situation that can be compounded by the wear and tear as we age. So runners are affected because runners are pounding all the time on their feet. Like each foot gets over 120 plus pounds on it. And when you throw another, 15 miles on top of the steps that we're getting on a regular basis, like runners' feet in particular are taking more of a beating. And with the biomechanic unbalance that happens with the bunion, you don't have that distribution of weight on your foot because that bone is hanging out on the side of your foot and not participating. It causes them pain. Oftentimes, though, I will say some people don't realize that it is a biomechanic issue, and they're like, well, the bunions don't cause me pain, but I have all these other issues with my foot. And then I have to explain to people, like, well, you probably have all those other issues because of your bunion.
Mm. So would you say that's the biggest misconception?
Yeah, I mean, I feel like I see a lot of patients who don't really know why a bunion is the cause, right? And so they're like, "Well, this bump just developed. Can you shave it off?" And I'm like, "Well, yeah, we can shave anything off, but do you want to? Because it's not that's not the appropriate way to go about fixing something. It's not the shape of your bone. I tell people that all the time. It's not the shape of your bone. It's not the bony growth that's happening. It's literally that your first ray is not centered correctly on its neighboring bone. So we call that the first metatarsal cuneiform joint. It's supposed to be straight. Yours is kind of off. So
Mm.
I think that's the biggest misconception. And once I show that to people on their x-rays, you can't unsee it. So then it makes a lot more sense.
Hmm, interesting. So tell us a little bit about how this does impact a person's daily life. You said you were talking about walking and running, but how else does it impact them?
Right. Well, particularly people with bunions tend to have flatter feet and a wider toe box. So shoes that are made for a regular foot sometimes don't fit you. So
Mm.
you're shoving your wider toe box foot into something that's way smaller. And so you're going to have that bump pain. You're going to have like friction rubbing against the sides of your foot. You're going to have difficulty balancing in certain dress shoes. I think the biggest thing that people come to me with is, are there bunion shoes? Like, can I just get a
That's I was just going to ask you that.
can I get a bunion shoe? And like the answer is yes, there are very much there's different recommendations that I can give to patients in regards to what type of sports shoe, what type of dress shoe. Do you need an insert? We can definitely approach people with bunions in a non-surgical way to get them more comfortable biomechanically, and whether or not your style suffers because of it, I mean that's on you. Because I mean nowadays there are good quality product out there, because
Mhm.
not all foot types are the same. And so I think that the shoe manufacturers are noticing that. So there's good news in that department. Um, but any of the things that, sometimes patients come in with these contraptions to, like, it looks like a torture device that's going to hold your toe into a place or crank this toe, and it's just
Mm.
not going to work because it's going to look fine when you're in the device, but then you're going to take the device off and you're going to be left with the foot that you have. So we have to protect the foot and support the foot that you have.
So you're going to talk to us a little bit about some treatment options for bunions that are available right now on the market. But before we do that, if somebody has a bunion and doesn't treat it, what could happen?
We hope nothing. Not everybody who has bunions is ultimately doomed to have surgery. I know a lot of people who will keep their bunions until the day they die and never have any problems.
Mm.
But you're not exempt from the possibilities of a lot of things that could be happening. First and foremost, it's pain. That's the number one reason as to consider a surgical fix to a problem is pain. And it's pain that's not fixed by anything else, right? If you've tried the wider shoes, if you've tried the inserts, that's when you want to kind of take that more of that surgical approach. But not all people with bunions need surgery.
Mm.
If
Mhm.
if you're that person, maybe an older individual who kind of is like, oh my gosh, I should have done this when I was 30, but now you're in your 80s. Surgery is now more of a complication than a benefit to you. There are other options for those folks.
Hmm. Great. That's good information. So let's talk a little bit about these treatment options. What's available for people out there?
So there's a ton of stuff available. So when people come to my office, I'm usually like surgery is generally not my first line of treatment for them. So I usually approach it with all the conservative things possible, toe spacers, different types of shoes, and inserts. I mandate that they try something just to see if they can be happy with the more external support, right? Now, when it comes to people who have tried and failed all the, you know, external devices, all the support, that's when we talk about surgery. And my number one thing that I mention in surgery is what's called a lapiplasty. The lapiplasty is a play on words. It's a lapidus bunionectomy. And it has been around for quite a while, but the folks at Lapiplasty have very much so cornered their specifics on how best to fix the bunion so it won't come back. And that's why I love the Lapiplasty, because the correction rate is great, and it keeps the percentage down of recurrence for sure. I'm having about 98% success rate.
Mhm.
Even if I'm removing the hardware at a later date, that bunion correction remains the same.
Mhm.
So it's actually a really good tool that I use for my patients who are willing to undergo that surgical correction.
Hmm. And who would make an ideal candidate for this procedure?
So, anyone who is above the years of 18 and anyone below 80, I feel like would fall into a good surgical candidate. Save for, specifics regarding health. You want to make sure that the person is actually going to be a good surgical candidate for recovery. So there's definitely, parameters around the specifics of each individual. But yeah, I think that my wheelhouse that I'm doing surgery on are patients about 27 to 45 in that age range, because the recovery rate is actually very good for those
Mm.
folks. I mean, um, bone essentially takes about 8 weeks to heal. You can't get around that. Your body is going to need 2 months to heal. But, with the Lapiplasty plating system, the way that it's very much so secure, I am having my patients walk early in a boot only. And I can't emphasize that enough. I tell people all the time, I say, you're walking in a boot. Like, you have to you have to say it back to me, because you're not healed
Yeah.
until 8 weeks, so usually I have my patients weight bearing only in the boot after about 2 weeks of non-weight bearing. And I would say I'm on the more conservative side. I know docs who use the Lapiplasty who are like almost immediately weight bearing their patients in the boot, but having had surgery myself, I know just like how I handled, the anesthesia and, the whole wrapping your mind around like, oh my God, I just had surgery. So I usually tell my patients, 2 weeks is a good time for you to just lay there in bed, watch some movies and Netflix. I'll see you for your appointment, and then the first steps you take are in the boot are with me watching you.
Mm.
So that's how I approach it. And then we kind of do our, regular routine post-operative care all the way until you're done with physical therapy.
Wow. So talk to us a little bit about the benefits and some of the risks associated with this surgery.
So there are a lot of risks to surgery. I tell my patients this all the time that a surgery of any kind is a planned trauma. Like you're not planning to go get in a car accident, but a surgery is something you're booking and scheduling to say, "Hey, I need something rearranged or fixed." And it's your body's going to go through that traumatized experience. With the Lapiplasty, I will say the pain we do mitigate substantially. So most of my patients state they don't need to even take all of the pain medications that I'm giving them, and I'm only really
Wow.
giving them 5 days worth. So I mean that's pretty good. But you will have nerves that come back, and that nerve pain. It's not exactly the worst pain, but it is shocking. It's like this zinger that comes at you out of nowhere and kind of
Mm.
goes away pretty quickly. That will happen, and then the waxing and waning of swelling is a huge thing that people like don't think are prepared for. Um, but I always tell people like when we're fixing something surgically and we're early weight bearing and gravity doesn't help, you will swell. So the waxing and waning of swelling usually takes about 6 months to completely go away. So I definitely prepare my patients for that, because sometimes it's a little unexpected.
And does insurance pay for this?
Yes, yes, insurance pays for it. Like I said, it depends on individual insurances and patients' deductibles and stuff like that. But usually insurances will pay for a bunion surgery. They will only pay if you failed conservative treatment. I will say that. So that's why I'm saying like not everybody who has bunions needs bunion surgery, but
Mm.
the majority of cases are definitely covered.
So if a runner, an avid runner or a triathlete, does come into your office and you do the surgery on them, how long will it take before they can get back on the pavement?
I would say anywhere between as early as 3 months, but most likely 4 months after surgery, you can get back to it. So
Mm.
I'm usually saying 2 months, you don't want to do anything because your bone is still healing. All we're doing
Mm.
is getting from point A to B in those first 2 months. In the third month, you are doing physical therapy, and it kind of depends on the patient how well they do in physical therapy and their recovery.
Mhm.
And then whatever their goals are, like I'm not going to sit here and say, oh, after you're in therapy, you're going to go get that 25, 26 mile run in. That's not realistic. Like you're going to be very much so out of shape and needing more condition. So it definitely depends on the person and how they recover in physical therapy after that time period.
So, what advice would you give someone who's starting to notice that they've got bunion symptoms, but they're not sure whether surgery is the right option for them?
Well, I would definitely consult your podiatrist. I mean, the best thing you can do for yourself is to actually see the progression of it. So I've had patients who are unsure if they're surgical candidates or not, and I usually get an x-ray, and then I tell them, hey, let's try some inserts, let's try some toe spacers and see how you work. And then a year from now, let's do another x-ray and have a check-in, and we'll compare the two, and we'll say, okay, well, let's measure some angles. If the IM angle is a little bit bigger and you're in a little bit more pain, then let's further discuss what's going to go happen with surgery. Or they could come back in a year or not come back in a year and be like, hey, doc, those new shoes and those inserts are working just great for me. And I'm like, great.
Exactly. That's
Yeah.
awesome. Good. That's awesome. I love when surgeons don't push surgery on their patients, you know? It's
Yeah.
just really feels it feels right to me, you know?
Yeah.
So tell me a little bit. I want to kind of shift gears a little bit, and I want to hear about My Feet Are Killing Me. Can you talk a little bit about that and, about the show and how you
Yeah.
got involved in it?
Right, it's kind of random. So, I mean, I started my private practice out here in California with as a independent contractor, and had to bring the people essentially. So, I essentially got on social media with a couple YouTube videos, Instagram, Facebook, and just let people know in the area, like, hey, I'm a podiatrist. Here I am. This is what I can do. And people started coming to the practice, and one of the producers in Los Angeles was like, "Hey, like you're really good at explaining stuff, and we're gonna make a show about feet." And I'm like, "Really? Are people gonna watch it?" And when all was said and done, they picked myself and Dr. Schaefer, and we were the host of the show, and it turned out to be a really successful 4 seasons, and
Wow.
yeah, it was a fun
That's
time.
that is so cool. That is really, really cool. Well, thank you for sharing that.
Of course.
So tell us how people could get in touch with you and, and really, I mean, you could really see anybody around the country, right? I mean,
So yeah, I mean, at some point we gotta get off telemedicine in order for me to actually do a physical exam. And I do see a fair share of telemedicine folks, and they're always like, "Well, why can't we just book the surgery?" I'm like, "Because I haven't seen your foot.
right. Yeah.
You can't just pop up." But we can do a lot of things via telemedicine. For instance, you can go get X-rays that I'll prescribe, and we'll talk about your shoe choice, and you can do a lot of things telemedicine wise. But when it comes to surgery, I do require patients to come and visit me so I can like tangibly see your foot and meet you in person. I think that that's a good way to start off your surgeon patient relationship. But yeah, you can always do telemedicine, but I am located in Southern California. I have offices in Orange, California, Long Beach, California, Huntington, and Irvine areas. So 4 offices. And yeah,
Do you have
I
a website or
yes,
any?
I do have a website. It's www.myocpodiatrist.com. Or you can always just Google Dr. Ebonie Vincent, and all of my social channels will come up. I will say you do spell my name a little differently. It's Ebony, Ebonie. But you can also find me if you misspell it. It's fine.
Thank you so
Well,
much.
thank
I
you so much.
appreciate your time.
Of course, anytime. Have a good day.